All right, welcome back, students. We are going to be hopping right back into our surgical instruments and materials PowerPoint, and we are going to be starting with the reproductive tract instruments that we will use, mostly for our large animals. So I'm going to go over the following tools. We'll look at castration and docking bands, an elastrator, emasculator, fecal extractor, which is when we're helping, or sorry, fetal extractor for when the cows are calving, obstetrical chain and handle, and the vaginal speculum. And to let you guys know, this castration and docking bands, docking is not necessarily a reproductive procedure, but it is a way to castrate these patients. And we'll see it commonly with like livestock medicine. All right, so these are the castration and docking bands. So we take these little rubber bands, they're really tight here, and they will put them on this tool here that can then has these 4 prongs, which will spread out the rubber band. They can then place that over the where the testicles are, or the tail if they're docking, to then remove. We'll do that when these livestock animals are infants, when they're just newborn babies. It is kind of common practice with livestock because they cannot have more than 1 bull in the herd in its entirety. So it is something that they'll routinely do for the young male cows. And that tool that they're going to use for the band to go on, this is an elastrator. So we'll put that tiny rubber band on there. It'll then expand out, and then we can place that band around the testes or the tail, depending on what we are trying to remove. Now it's going to cut off the blood circulation, and it's going to take anywhere between 5 to 7 days to actually have its full effect, sometimes a little bit longer, to remove what it was banded around. These are emasculators, and we will use these to castrate livestock animals. So when we are doing that castration procedure, remember that's just the neutering in our large animals, we will make an incision and pull the testes out, and then they will use this tool to wrap around the somatic cord, and it's going to crush and cut it at the same time. Usually they don't even have to place any sutures because of that, the pressure that it makes. It'll adhere to both sides of where you removed it from the spermatic cord. This is similar to the tool that we use in horses. And again, the big difference between the castration versus the neuters is castration is going to usually have an open incision. We don't usually close, versus neuters, we will absolutely suture it closed. Now, this is a tool, this is a fecal extractor. We'll use this with our bovine patients, whether this is beef or dairy cattle. So when the cattle is in parturition, so when they're giving birth, sometimes there can be complications, and especially if it's a first-time mama, it's never had a calf before, it can be harder for them to go through that parturition process. So this is 2 cattle hands helping here. They have the fecal extractor connected pole to the caudal aspect of the cow. And then there's a little handle here with some cranks, so they can actually use that to then kind of counter pressure. They can even attach the front legs of the calf to a chain here to help kind of do a pulley system to extract the calf. And getting more into with that pulley system and the chains that we can use, this is obstetrical chain and handle. So we'll use this chain. It also can be roping to go around the calf's ankle region. And then we'll be able to successfully kind of put it on that pulley system with this extractor to help pull them out. So as you can see, this calf would be then moving through the pelvis. There's not a whole lot of extra wiggle room there. So it does definitely help, especially if it's a first-time mama, to help deliver that calf. Yeah, so there's a lot of reason why sorry, I'm just looking up in the chat there. There's a lot of reasons why we would, going back to like the tail docking, there's a lot of reasons why we would remove the tail, especially in just any type of livestock, whether that's, even looking at like goats and sheep. A lot of it is we don't want that tail to get wound up or broken in, just in the herd in general with all that activity going on. We also do not want feces to get stuck to that tail. It can cause infection and other issues there. So a lot of livestock animals will have docked tails. Same with swine, you guys. Usually swine is going to have docked tails, whether they might still have a little bit of a curly Q, but if they are specifically bred for meat, we'll remove the tail, we'll dock that tail, just because it can get wrapped around things and broken, and we don't want them to be possibly at risk for that. So getting into another instrument, this is a vaginal speculum. So we will insert this speculum into the vaginal canal, and then we can crank it open to expand it to then take a look at the cervix. So when they are doing the artificial insemination of these animals, they'll need to use a vaginal speculum to open up the canal, visualize the cervix, and they'll either fertilize or extract that sperm into the cervix or push it further into the uterus. But without a tool like this, we're not going to have adequate visualization. And they can be metal. They can also be harder plastic. It doesn't have to be like this stainless steel, but the upside of this stainless steel is we can put this through a steam autoclave and we can sterilize it. All right, so getting into the last part of the lecture for today. So I'm going to go over different miscellaneous tools that we use in small animal medicine. And just kind of depending on what we're doing in those procedures and such. So we have an Elizabethan collar, also known as an e-collar. So they're cone, a fecal loop, fecalizers, feeding tube for small animals. And I'll show you guys a video about that. Silver nitrate sticks, really similar to Quick Stop. Small animal oxygen tanks, you'll see those in ERs and ICUs. A Tomcat urinary catheter and a tourniquet. So our Elizabethan collar, these are also known as the e-collars or the cone of shame. So we're going to use these on our patients post-procedure, especially if they've had a surgical procedure, because we want to prevent any licking or biting of the sutures or any of those sensitive areas that was worked on. We can also do this to promote healing. If the patient has a skin condition or is constantly looking at their paws and irritating the skin, we can use an e-collar to prevent that licking. And they make several different types of e-collars. Some of them will clip together, others are Velcro. They have ones with loops on the bottom that you can loop through the collar. They also make soft e-collars. So it's like a nice nylon material to where it's not so hard and bulky. And I've even seen it go as far as like at Petco, they're selling these, like, it's like a donut. It's a big blow up donut that goes around the dog's neck. That can, same thing, it's just going to help them not be able to reach that area to lick or to bite. So a lot of variety with these. These are standard. We'll use them all the time. This instrument here is a fecal loop. So if the patient comes in for their annual exam, we usually run the fecal test at that time. And if the owner doesn't bring a fecal sample, or if we're unable to get a fecal sample from the patient, we walked them outside, they won't go, then we can resort to using a fecal loop. So the fecal loop is going to have two loops at each end. Usually one is a little bit smaller than the other. We'll put a little bit of lubrication on the end of the fecal loop, and then we'll insert it into the rectum, and we'll kind of insert it, twist it around a little bit, and it's going to catch a small amount of poop in this loop here. So when we take it out, we can then collect that small sample and then run an in-house fecal test. It's usually not enough to send it out to the lab, but you can do an in-house, which means in your hospital, test for those parasites. Guys, what's an example of some parasites we're going to see on a fecal test? What are some internal parasites? Tapeworms, absolutely, that's one. But actually, tapeworms are so large that they are so heavy that they don't show up on fecal floats, but we can see them clear as day in the stool. They look like little grains of rice. What are some others? And this is our little fecalizer we'll use for this test. So heartworms is another. Heartworms, though, we're not going to see that in a fecal test. Heartworms live in the heart. So we actually have to do a blood sample test to test them for heartworms. What are some other gastrointestinal? Think about it. Some other worms. Hookworms, absolutely, Michelle. Any other guesses? I highly recommend that you guys review your module 106 before your externship. You guys are all seniors here. So you will need to know this when going into your externship, what we're testing for, what we educate these clients on. So hookworms is one, tapeworms is another. We also have roundworms, we have lungworms, coccidia, giardia. There is a lot of parasites that are out there, and we can get these parasites too. So it's really, really important that we're informed about them. And we're going to be performing a fecal test through one of these fecalizers. This is what we can use for in-house. So if you used a fecal loop, you got a small amount of fecal matter, we can place that into this tube and we'll fill it with like a sugar dextrose solution. We'll make what's called like poop soup. And we'll stir that together. We'll place a slide on top, a cover slip on top, and wait for 10 minutes. And because of the sugar solution that we put in there, all of the eggs, ovas will float to the top and stick to that cover slip. Once that process is done, we'll remove that cover slip and place it onto a slide and interpret it under the microscope. So great for in-house testing, but sometimes it's not as accurate. We can send it off to the lab and they can do more comprehensive testing with it. All right, so getting into feeding tubes for small animals. So we have this one on the left-hand side. It's a red rubber. This is really commonly seen with these feeding tubes. They do have other ones that have different attachments at the top. And we'll use that with our small animals. Now we place these feeding tubes, actually we'll make an incision, that it's a surgical procedure. The doctor will make an incision on the side of their neck and insert it into their esophagus that goes down into their stomach. So it's not going to go through their nose or through their mouth. However, if we're working with livestock or horses, the feeding tube will go through the nose. It is a larger passageway. We can do that. So I do want to show you guys a quick video on those feeding tubes because that is important. It's a little bit different with our pets. All right.
My name is Jen, and I'm a veterinary technician, and I'm going to show you today how to properly feed your cat through an esophagostomy tube at home. There are many reasons why we place an esophagostomy tube for feeding. Usually there's a reason that your cat can't or won't eat, and this may be something that you'll be doing at home for a period of a week to several weeks, depending on the cat's condition. We do also place them in dogs, but more often it would be in a cat. So today we're going to go over how to mix up your food as well as how to properly feed. As with any medical procedure, you want to follow the instructions of your veterinarian for the exact recipe of the food, as well as the volume of food that you're going to feed over how long. But we'll go over this information in a general sense. So before you go and get your cat or your dog for the feeding, I recommend getting all of your supplies ready first so that you don't have to have them sitting there waiting for you. The first step is going to be mixing up your food. Usually we'll use a high calorie food like AD. Some pets will require a hypoallergenic diet. Your doctor should give you the proper diet for your pet and give you instructions on how much food to how much water to mix up. Usually it will be a can or a cup of dry food mixed with a volume of water, usually about a cup of water. We're then going to put that into a blender and mix it up to a very thin kind of gruel consistency. You can mix up more than one portion of the diet at one time, but you'll want to refrigerate the unused portion. Today, we're going to feed our cat 20 milliliters of this diet. This is a hypoallergenic diet that's been mixed up to the correct consistency. You want it to be thin enough, kind of like a soup, to be able to push it easily through that tube. I've also drawn up 12 milliliters of water. Tap water is fine. And this we're going to use to flush the tube before and after our feeding. You never want to leave food sitting in the tube because it can harden in there and become encrusted, and then you would be unable to feed or flush through the tube. Before we start the feeding, we will flush the tube with water to make sure that it's flushing easily, that it's not clogged, and to make sure that our cat is tolerating the feeding. If you see any coughing or retching as you're flushing, you'd want to stop your feeding immediately and call your veterinarian and have that tube checked to make sure that it hasn't been dislodged and moved to the wrong place. Once we have our food and our water drawn up, we're ready to get our cat. All right, now that
So we're going to prep everything and have it all ready before we get our patient out. Usually cats with feeding tubes, it's more common to see our cats with feeding tubes. We can sometimes see dogs with feeding tubes as well, older dogs. But cats definitely will have that like immediate reaction of not wanting to eat when they don't feel well. So we do end up doing them more commonly on our cats. And she'll make like a slurry of the food, depending on what kind of food or replacement that the doctor is wanting. And she's going to show you how she's going to open up and administer the feeding for this patient.
We have our kitty and we're ready to feed. We want to check the wrap that's holding the tube in place. We want to make sure that we're able to fit 2 fingers inside that wrap so it's not too tight. We also want to every day, or at least every couple of days, check the insertion site of where that tube is actually going into the side of her neck. So typically that's going to be here on the left side of the neck. There's a small incision with some sutures holding the tube in place. If you gently lift the wrap, you can sort of look at that insertion site, make sure that there's not a lot of discharge there, that it's not red or having any signs of an infection, like a green or yellow discharge or any foul odor. Those could be signs of an infection, and we'd want you to call your veterinarian as soon as you saw that. Once you've ensured that the tube is still in place, the wrap is in a good spot, you can free the tube. In this particular kitty wrap, it has Velcro tabs here that you just lift up and you free your tube. Different hospitals will use a different wrap system. Some of them will have a little gauze there that may be holding it on with a bit of tape. Just undo your tube so that it's free and ready to feed. And then you can begin the process of feeding. Now, this particular tube has a couple of different ports on it that will mate with different sizes of syringes. Other hospitals may use a different type of tube. It's common that they will place a red rubber tube that may have an adapter like this attached to it, as well as a little cap. Either of these systems will use the same syringes that we have available here. For the purpose of this demonstration, I'm going to use this Mila kind of feeding tube that has these 2 different adapters.
And the feeding tube, it's not going to be painful for this patient. It should be rather comfortable. They're going to have a nice neck band that's going to hold it in place. And feeding tubes can stay in from anywhere between a week to, I've seen it up to 8 months. If you're taking good care of it and you're cleaning it, we don't necessarily have to remove it and place new ones. So she's just going to go over what it's like to deal with the openings here, how to open and close and flush with water and with food. We're not going to finish, I'm not going to have you guys watch the entirety of it, but just get an idea of what it's going to look like when performing this tube feeding.
Little cap. And before you put any food through the tube, we're going to use our water and flush. Now, to get through the full length of the tube, you're going to want to flush with about 5 or 6 milliliters of water. So you're going to attach that to your stopper. And then you're going to depress this plunger. I have filled the syringe with 12 milliliters of water for the ease of flushing before and after the feeding. So I'm going to give it from the 12 down to the 6. And you should feel a small amount of resistance as you flush, but then it should flush smoothly. So we've made sure that she's not coughing, she's comfortable as we're flushing, and it flushed easily. Now we're ready to give our food. So we're going to remove our water. We're going to attach our syringe with our proper diet. And we're going to do the same. We're going to slowly depress this plunger and administer the diet through the tube. Now, it's important that this diet be given slowly so that we don't overexpand her stomach too quickly and make her feel nauseous and vomit. It's also good to have the diet at room temperature or slightly warmer. If you give a really cold diet, say it was refrigerated, that can be uncomfortable for them and make them more likely to vomit as well. There's no
So we're going to take quite a bit amount of time to do this tube feeding. We should be doing this over, anywhere from 10 to 20 minutes, depending on how much volume we're giving. If we give it too quickly, the chance of our patients vomiting is going to increase significantly. And of course, because they're on a feeding tube, we don't want them to vomit. That's not the goal. So we always want to go slow with this and be giving them breaks in between and flushing. And you'll see a lot of, especially if you work in emergency medicine, a lot of feeding tubes do get placed, or in ICU critical care, but patients can go home on feeding tubes. We can definitely do demonstrations for the owners and teach them how to use them. I had one patient previously that had the feeding tube in for more than 8 months as she was healing, and the owners, we taught them how to do it. They took her home, they kept it clean, they did a fantastic job. And so it's not something that they necessarily have to be hospitalized for. And she's going to pulse in that food. And if we notice that it gets stuck, she's actually going to take some water to it. She's going to flush it out with the water. Sometimes the feeding tubes do get dislodged and things get stuck. So really important that we're like blending down any of that food that we're giving that patient. And I just want to show you guys here kind of what this neck covering looks like when she's all done.
You want to reattach it using the Velcro or tape straps that are attached to the bandage, just to keep that out of her way. And she's still comfortable. She was happy through that entire feeding. She can still move her neck around with this wrap on. She can still eat on her own if she's allowed to. And so this should not be a huge imposition on her life.
Yep. So like she was just saying, these animals can still eat like normal, even though that they have a feeding tube placed. That's not going to impede that. Granted, we'd want to feed more wet food than solid food, but it is something that they can start to eat with that feeding tube still placed. And that's going to also help us determine, can we take it out? All right. Now, the next instrument I want to talk about, these are silver nitrate sticks. They're really similar to Quick Stop. And we'll use these to help cauterize blood vessels. They can use these more in like a surgical or a wound care procedure, but primarily what they're known for, just like Quick Stop, is for when we're cutting the nails. When we trim patients' nails, sometimes we can accidentally cut the quick. And the quick is that pink meaty part that's within the nail that's live. And if you cut that, it will start to bleed, and it's going to keep bleeding until we put a fixative on it that will help stop the bleeding. So these silver nitrate sticks can be great for that, or that Quick Stop powder we can use to cauterize those blood vessels. I've also seen them use silver nitrate sticks if they're removing like little lumps or skin tags. It's a great way to just cauterize the area really quick. Rather than using like a big messy powder like Quick Stop. So these are less mess. They work just as well, if not better. You may or may not see them. The next piece of equipment I want to talk about is the small animal oxygen cage. So these two top kennels in the top that have this glass pane covering as the doors, these are oxygen tanks. So we don't have to put our patients on like oxygen tubing. We will just place them in these kennels. It's got all the control boards over here. We do have to have it connected to this humidifier and everything so that the patient is getting, we can also nebulize them this way while they're getting their flow of oxygen. Now, this kennel actually has a door in the middle. You can remove it or you can keep it there. So if you want to make it into a bigger kennel, let's say we have a large dog that needs to be on oxygen, we can make it larger or we can make it smaller. And we'll control all of the oxygen flow over here. Now, we're only really going to see these oxygen cages in emergency medicine or in like specialty ICU critical care or surgical centers. They're not going to be common practice. These are really, really expensive kennels, you guys. I mean, upwards of probably $80,000, depending on what model that you're purchasing. And then you also have to have central line oxygen. So it does take a lot to have cages like this, and it's really expensive to have pets in these oxygen cages. I believe at my last clinic that I was at, it was about $80 an hour because they're getting continuous flow of oxygen. 100% oxygen is not cheap. And being in machines like this that take a lot of power and energy to run, we also have to have somebody constantly monitoring these patients. So you're paying for the oxygen and the monitoring fee. Somebody will be sitting there or standing there watching them continuously. So these are great. We can use them rather than putting them like on an oxygen mask. Unless the patient is lateral and, not feeling well at all, they're usually not going to be tolerant of just having an oxygen mask on their face. So that's where these kennels can really come into handy. And they do have this little door opening at the center. So we can actually, if we just need to do something to the patient real quick, or we just want to say hi without completely breaking the seal and letting all the oxygen out, we can open up this little door here to do what we need to do if needed. Now, if we do open this large door, we're going to then break that oxygen seal. When we do that, unfortunately, all of the oxygen is going to come out into the regular environment. Once we close the doors back again, it can take 15 minutes for this chamber to reach 100% oxygen again. So unless that patient needs to come out for that procedure or treatment, we want to keep them in there. I also want to touch on, this is a urinary Tomcat catheter. So this is a urinary catheter that we're going to place in our male cats. Blocking is really, really common in our male cats. And that is when they have a blockage somewhere along their ureter. This could either be the ureter into the bladder or the urethra, where they're unable to pass urine. It's usually right through the urethra, even passing all the way through into the prepuce for these males, unfortunately. So with these male cats, we will be placing a urinary catheter. As you can see, they're varying in length and in thickness. So we'll place this through the urethra until it sits into the bladder. It will usually push any crystals or any blockage out of the way, and then they can successfully urinate. These catheters will either be connected to a fluid bag to accumulate all of the like an empty fluid bag to accumulate all of the urine, or we can just have that catheter placed in and then they can freely urinate. Now, urinary catheters are temporary. They're not supposed to be in the patients longer than a week without being replaced. And once a cat does become blocked, these male cats, they're prone to becoming blocked again. Blockages are usually caused by urinary crystals, and they can be quite common depending on the food regimen that you're feeding your patient. So our main defense of treatment for preventing urinary blockages is actually changing the diet. There are several prescription diets for urinary issues in cats that will stop the production of those crystals. It will balance out the pH and the acidity in the urine. So just by making a simple food switch, the cat can live a long, happy life and never be blocked again. If the patient repeatedly gets blocked, there's going to be scar tissue buildup from having these catheters placed over and over and over again. And that's where we might have to do that PU surgery. Remember in chapter 9, we talked about that. That's when we actually will basically shorten that urethra for the males and have their urinary opening back towards their anus, just like the females. So, and that's because of all of that buildup of scar tissue from the constant placement of these catheters. So with these male cats, again, they can get blocked. And if they do, they're more likely to get blocked again. But there's really easy treatment methods, just as simple as switching the food. Now, the last piece of equipment I want to touch on today, this is a tourniquet. So we will use a tourniquet. We can place the animal's limb, like let's say it's the front leg, through the looped end of the tourniquet, and then we'll tighten it. And that will help cut off the blood supply and support the vein. So if I am placing a IV catheter on a cat, and I've already sedated them, they're going to be really sedate. I don't really need a restrainer at that point. I can just put a tourniquet on the leg, tighten it, and twist it, and then I can place a IV catheter by myself. I can also do this for blood draws as well, especially like if, let's say, maybe the person that's restraining isn't super confident with holding off the vein. I can use a tourniquet instead. Some people prefer tourniquets because we can get them tighter and roll the vein a lot better. But usually we're just working them when we are working by ourselves with a sedated patient rather than taking two people away. You can only, you can have it be a one person job just with the use of some extra equipment here. All right, and next lecture, we're going to hop into large animal of the miscellaneous instruments. So we will finish this up at the next time that we meet here on Zoom, which will be on Thursday. So we'll be going over all of these different instruments for these large animals. And that'll be the end for this chapter or for the miscellaneous instruments and materials used in surgical.